struggling with autoimmunity or know someone who is, well, stay tuned because today I'm going to talk about one of my favorite therapies for really pushing significant healing in your body. So, most people who have been diagnosed with an autoimmune condition have tried many different things. And that might be medications or diets, nutritional approaches. But I'm guessing you likely haven't tried ozone therapy for your autoimmunity and your healing pathways. So I'm super excited today to dive into a therapy that I have used for years in my people to really just take their healing potential to the next level. And so I'm going to tell you why, tell you what it is. So what is ozone therapy? Ozone therapy is a form of oxygen therapy that is actually O3. So we breathe oxygen, which is O2. Ozone is made by medical generators that create the O3 molecule. Then that can be put into the body in a bunch of different ways, which I'll go over. So you might think like, why would I want to do that? What is it going to do for me? It is hands down incredible. It is what I would put on the list, we call it a regenerative medicine. So if we think about regeneration, we think about, improvement, pushing healing, taking tissues that are malfunctioning and creating amazing healing functioning ability. So when we take ozone and we put it into the body, it reduces inflammation systemically all throughout the body. And this is really important for autoimmunity because, not every autoimmune condition is systemic, but many of them are. So if we think about, if you're Hashimoto's, your Graves, rheumatoid arthritis, MS, lupus, any of those, and in the list, mixed connective tissue disease, the list goes on. So to get something that has a very natural, powerful ability to reduce inflammation all throughout all the tissues is just incredible, and that's what ozone does. So the other major thing that I absolutely love for my autoimmune people is that it significantly improves detoxification. And this is where many people with autoimmunity are very, very impaired, right? We don't know exactly what the onset of autoimmunity in each individual is. The theory is that it's a reaction to a virus that the body mistook, and now it's reacting and killing your own cells or trying to destroy them. There can be inflammatory exposures that actually will then push that inflammatory response to the body and then make the autoimmunity worse. And that could be viral, it could be metals like lead, mercury, arsenic, that can be chemicals, right? So all of those are initiators and fuel on the fire. And so people genetically often who have autoimmunity are very poor detoxifiers. They do not move the things out of their body. So say if you have a group of people, the people with autoimmunity, that all have the same exposure, the people who are really healthy, usually the body is like liver or the cells, the lymph system is so great about getting, when something comes in, it pushes it out. People with autoimmunity, often they accumulate that, and it just, as we call it, like the bucket becomes full, and when it overflows, that's symptoms, right? So we get so much movement in this area, and so I love combining it. When we are identifying the things that are in the body that need to be moved out, ozone is going to help with that. So regeneration of the tissue, that comes back to the overall healing, right? So often there's tissue destruction in autoimmunity. Not every time, but often if we're thinking about, Hashimoto's or Graves', there's destruction of the thyroid. If you think about rheumatoid arthritis, there's destruction of your joints. Mixed connective tissue disease, it's going after your literal tissues, all your tissues, your muscles and other types like your tendons, things like that. So when you introduce oxygen or ozone specifically into a space, it actually allows that tissue to start healing and repairing. And that's everywhere. So if we're doing it systemic, and I'll talk about how we do that, we're going to get full body healing, which is just incredible to me. The other thing is that it's going to significantly increase your own internal antioxidant stores. So people don't often know that we make our own antioxidants. So for instance, we make glutathione in our bodies, which is considered the master antioxidant. We also make other forms that go in and specifically heal our tissues. We don't make vitamin C, so most people probably know that because of scurvy. That's just a little side note. But ozone will actually push all of those. The body will ramp those up in response to that oxygen or ozone coming into the tissue. Then the last thing, I really like that ozone does for us is that most of us are carrying around some form of chronic viral infection. So that's Epstein-Barr, that's cytomegalovirus, that's the herpes viruses. I mean, all of them are kind of a load on your immune system, and they're irritating to your immune system. So we actually get significant decrease in viral load, no matter what virus we're dealing with. And we've had studies on, there've been studies on hepatitis, there've been studies on Ebola, some crazy, crazy stuff. You're like, it's really amazing when it comes to like reducing viral load. So, and so important for our autoimmune people. So let's talk about a specific study on RA. So most people, rheumatoid arthritis, a lot of times if you're dealing with a more severe RA, you are likely, or you're being talked to about, or you're on methotrexate or some version of that, because that will stop the immune system, or really slow down the immune system from destroying the joints. So they did a study where they gave ozone and then looked at the tissues, looked at disease progression, looked at how patients were doing, and they found that ozone had a significant impact on the ability of that tissue to heal and reduction in pain, saving of the joints. Now, when the people that were in this group that were just on methotrexate, they actually, while, because again, it is an immune suppressor, right? So there was less destruction of the joints, but there wasn't any evidence of healing in that tissue. And the antioxidant levels were tanked, like they were just super, super low. So they did another group of people who were on methotrexate and then also got the oxygen. It was really incredible. So even though they were on this pretty severely toxic medication, it's actually a chemotherapeutic agent, the body was still able to work on regenerating the tissue, healing the tissue, and when they measured the antioxidant levels, they were way up. So it's like, it kind of goes to show, it's like even if you're on one of what we call the disease modifying agents, the DMARDs, like you can still actually incorporate ozone into your therapy, and I would highly encourage it. So I thought that was an amazing study. So let's go into a little bit about detoxification. So we do have other videos where I've done a deep dive on what are, some of the other things that we really like to do for people with autoimmunity, and when it comes to nutrition and diet and cleaning up your space and cleaning up your body as far as, things, toxins. But so please definitely check those out. You'll like that. But I do want to talk a little bit about detoxification, because it really is kind of the cornerstone of healing for people with autoimmunity. And so we have to identify, like, do you have mold in your body? Have you had significant heavy metal exposure? That's like mercury fillings, lead in your water. And then a lot of people have like childhood exposure that is still sticking around. We need to see that, we need to measure that, in addition to looking at different chemicals and then viral toxicity. So ozone, though, I mean, we need to see these levels, we need to monitor them so we can do other things to help treat them. But when we add ozone to our detox protocols, I have seen people shift, like say for instance, they have autoimmunity, they have a ton of mold. We're doing all the amazing things for them, right? We're doing the specific binders, we're doing the antioxidants. When I add ozone to that, it's like the treatment, the detoxability, the healing, people feeling better, it just goes through the roof. So I am a huge believer. It's like, if we can incorporate this in any way into your current protocol, it's just going to be amazing for you. So how can we do it? Like, how can we get this into your body? So ideally, we're doing it systemically. So that's either going to be an IV, we call it IV MAH. And so that's where, very briefly, it's if you have more questions about this, because usually describing this brings up a lot of questions for people, what we do is we pull your blood out, combined with a little bit of heparin, a blood thinner. It goes into a sterile saline IV bag, and then the oxygen is infused in there, and then you're given that back as an IV. And just such an incredible therapy. So usually we want to do a series of those. I would say if it's more significant, your autoimmunity is, I'd probably say 10 of those. We can do it systemically through doing something called rectal insufflation, and that's where we teach you how to, basically it's like a gas enema, and it will absorb through your colon and go throughout your body. We really need to do those more frequently because they're not as powerful as the IVs, but if for any reason we can't do the IVs, then that is an option, or sometimes we add that on as a home option just to further support you. And we have to, again, it's medically supervised as well. So, what would you need to get started? Essentially, of course, come and see us. What we need to do for you first is do a screening of your iron levels. If they're too high, we need to bring those down before we start, ideally. And then also check your G6PD, which is a very simple and inexpensive test, just to make sure your cells can tolerate ozone. It's very rare for somebody not to be able to, but we just have to screen for it anyhow. So if you have any questions about ozone, it's such an incredible therapy, interested in trying it, We would love to see you. Please reach out with any questions. And thanks for joining me today.